Hey there, health enthusiasts! Welcome back to our channel. Today, we're diving deep into the world of contraception. We'll cover most of the approved methods, their efficacy, and also their potential side effects. Let's get started. Contraception methods can be broadly categorized into barrier methods, hormonal methods, intrauterine devices also known as IUDs, emergency contraception, natural methods, and sterilization. We'll explore each category, its associated methods, their efficacy, and potential side effects. Starting with barrier methods. These physically prevent sperm from reaching the egg. This category includes male condoms, with typical use failure rate of about 13%. Side effects are rare, but some people may be allergic to latex. The FC2 female condom is the only woman-controlled device for preventing sexually transmitted infections and pregnancy. To place the female condom, the inner ring is held, squeezing it with the thumb and middle finger so it becomes long and narrow. Then, after getting into a comfortable position, the inner ring is pushed all the way back behind the pubic bone over the cervix. Once placed, the condom should feel comfortable. If not, it should be removed and replaced with a new one. When initiating intercourse, the outer ring of the FC2 condom is folded in place to prevent it from sliding inside the vagina. After intercourse and before standing up, the condom is removed by twisting the outer ring once, then pulling it out and throwing it away. Diaphragms and cervical caps are placed inside the vagina to cover the cervix to block sperm. One example is the Kea contoured diaphragm. Before insertion, spermicide or contraceptive gel is applied to the device. The Kea is then pushed deeply along the back vaginal wall until the cervix rests inside the cup. During and after sex, Kea prevents sperm cells from entering through the cervix into the uterus, which prevents unwanted pregnancies. After use, the diaphragm can be washed with soap and water. It can be reused for up to 2 years. Typical use failure rate for the diaphragm is about 17%. Next, we have hormonal methods. These work by interfering with ovulation. Combined oral contraceptives contain the hormones estrogen and progestin. A pill is taken at the same time each day. They may not be a safe option in women older than 35 who smoke or those who have had blood clots or breast cancer. The typical use failure rate is 7%. The progestin-only pill, sometimes called mini pill, only has one hormone, which is progestin, instead of both estrogen and progestin like combined oral contraceptives. It is taken at the same time each day. It may be a better option for women who can't take estrogen. The typical use failure rate is 7%. The skin patch releases hormones progestin and estrogen into the bloodstream. It can be placed on the lower abdomen, buttocks, or upper body. It should not be placed on the breasts. A skin patch is usually placed for the duration of 3 weeks. To allow a menstrual period, the patch is not used for the 4th week. The typical use failure rate is 7%. The vaginal ring releases the hormones progestin and estrogen. It is placed inside the vagina for 3 weeks. It is then taken out for 1 week to allow a period, and then a new ring is placed. The typical use failure rate is 7%. Hormonal birth control pills, the patch and the vaginal ring share similar side effects such as irregular or decreased menstrual bleeding, nausea, increased breast size or breast tenderness, headaches, or mood changes. Additionally, the vaginal ring may cause vaginal irritation. The implant is a single thin rod. One example of such an implant is Nexplanon. It is inserted under the skin of a woman's upper arm. The rod contains a progestin that is released into the body over 3 years. The typical use failure rate is 0.1%. Common side effects are mood changes, acne, lighter or skipped periods. Contraceptive injection, also known as shot, contain the hormone progestin. One well-known brand name is Depo-Provera. It is injected in the buttocks or arm every 3 months. The typical use failure rate is 4%. Common side effects are increased appetite, risk for osteoporosis if used for a long time, irregular periods, mood changes, breast soreness, and headaches. Intrauterine devices, or IUDs, come in 2 types, the copper IUD and the hormonal IUD. A levonorgestrel intrauterine system, such as Mirena, is a small T-shaped device. It is placed inside the uterus and it releases a small amount of progestin each day to prevent pregnancy. The device is placed for the purpose of contraception for the duration of 3 years for Skyla, 5 years for Kylena, or up to 8 years for Liletta and Mirena. Typical use failure rate is somewhere between 0.1 to 0.4%. Common side effects are acne, mood changes, lighter or skipped periods, cramping, irregular spotting, which is more often seen in the months following placement. The device may be placed the wrong position, making it ineffective. Occasionally, the IUD may perforate through the wall of the uterus and end up inside the abdomen. A copper IUD, such as Paragard, is a small device that is shaped in the form of a T. It is placed inside the uterus to prevent pregnancy. It can stay in the uterus for up to 10 years. Typical use failure rate is 0.8%. Common side effects of the copper IUD are heavier menstrual bleeding and cramping. Emergency contraception includes the morning after pill and the copper IUD. Emergency contraception can be used up to 5 days after unprotected sex. The morning after pill has a variable failure rate, depending on when it is taken following intercourse, from about 4% at 72 hours or 3 days to about 10% at 5 days. Natural methods of contraception involve tracking your menstrual cycle. These methods are about 76 to 88% effective and have no physical side effects. But they require significant dedication and understanding of one's cycle. Finally, we come to sterilization, which includes methods like tubal ligation and vasectomy, both of which are permanent forms of birth control. In the case of tubal ligation, often referred to as tying the tubes, the fallopian tubes are tied in such a way that it prevents the sperm and eggs from uniting, thus averting fertilization. This procedure can be carried out in either a hospital setting or an outpatient surgical facility. Generally, women can return home on the same day the surgery is performed and resume their usual routines within several days. This method is effective immediately. Typical use failure rate is 0.5%. Vasectomy is a medical procedure performed to prevent the passage of sperm into a man's penis during ejaculation. Consequently, the ejaculate becomes devoid of sperm, rendering it incapable of fertilizing an egg. Usually carried out on an outpatient basis under local anesthesia, men can generally return home on the same day. After the procedure, it is necessary to undergo testing to confirm that the sperm count has reached 0, which typically takes approximately 12 weeks. As a precautionary measure, an alternative form of contraception should be used until the sperm count has been confirmed as 0. Typical use failure rate for vasectomy is about 0.15%. As always, it's important to remember that while these methods are highly effective at preventing pregnancy, only condoms offer protection against sexually transmitted infections. So, consider dual protection if you're at risk. Remember, side effects vary from person to person. While one person might experience a side effect, another may not. This is why it's so important to talk with a healthcare provider to figure out what's best for your lifestyle, your health, and your family planning goals. Everyone is different. What works best for one person might not work as well for another. The most effective contraception is the one you feel comfortable with, can use consistently and correctly, and whose side effects you can manage. So, take the time to research, ask questions, and make an informed decision that suits you. And that's a wrap on our comprehensive review of contraception methods and their potential side effects. Stay healthy and see you in the next video.